Hello friends, today's topic of discussion is cannula and its parts. So, why is cannula important for us? Cannula is important both for practical reason and for your exam purpose. Cannula you have to insert somewhere or the other wherever you are posted, and for examination point of view it is important to know what is a cannula and what are its various parts. So firstly, what is a cannula? So it is a thin tube which is inserted into your vein or body cavity. And what does it do? It is used for delivery of medicines or removal of fluids from the body cavity that it is inserted in. And third and most important, the use that we usually see is drawing of samples. So now we know what a cannula is. Let's see what are the parts of a cannula. So you can see a picture of a cannula here with all its parts labeled. So let's start with the most distal part. So you can see here, this is a luer lock cap. So what does this luer lock cap do? It can be removed easily and it is used to connect the cannula to the external device, whatever it is, it has to be connected with. Okay. So in this you can see this is a cannula and this is a luer cap which can be very easily removed. Okay. Now just proximal to it is a flashback chamber. What is a flashback chamber? So now when you're inserting the cannula, how would you know that it has been inserted into the vein? How will you identify it? So what happens is the moment the cannula enters into a vein, a slight amount of blood flows back into this reservoir. This is a open space. This is a empty space in which the blood comes back and stays, and you can see it from here that once the blood has come here, we know that the cannula has been inserted rightly into the vein, and then we can proceed for its fixation, right? So what is this called? This is called flashback chamber. Coming to the more proximal part, this you can see is at a slight height and it is called needle grip. Now it has the word grip, so you must understand that it is used for making a grip. Now this is your needle grip. What you need to know along with it is this catheter hub plus wings. So you see this is your needle grip and these are your wings. Why wings? These are flagellating outside from the body. So these are the wings. So what does it do? Whenever you're holding a cannula, how will you hold it? You have your thumb here and you have your fingers here. So now the process of insertion would be easier. So what is the use? This is ergonomic. That's the word for it. That when you're inserting the cannula, it becomes easy to hold the cannula and insert it properly. Okay, so these parts. Now you can see this is a cap. This cap opens up. What is this cap? And you can see there is a hole here. What is this cap? It is called injection port cap. Now as the name suggests, now once you've inserted the cannula, any injection that you want to put in, you can put in through this cap. So therefore the name injection port cannula. Just below it is the luer connector, your catheter part, and the part that is going to connect your external devices to your cannula is connected through this part which is called as luer connector, right? Now Going further proximal is a very short space here and it has a valve. What does a valve usually do? Your valve regulates the flow of fluid. Wherever this valve is present, it regulates the flow of fluid. So in this cannula also, whatever the fluids are going inside or coming out, it regulates the flow of those fluids. Right? Now, coming to the next part, this you can see the bluish part, if it is visible here, this bluish part is the bushing. Now, what is a bushing? This is your other part of the cannula and this is your main cannula which is going to be inserted into the vein. Now, this bushing is what connects these both parts. This is like an external covering. So, what is its use? It makes your cannula leak free. Okay, this you have to remember. Now, further ahead, if you see, now here it only one needle-like structure would be visible, but it is actually two structures. The needle is inside it and covering it is a thin flexible part which is your actual cannula. So what happens is you can see here the needle and the catheter. We have these two parts. So the needle is present inside and what happens is once your cannula has been inserted, what you do is, what is the use of needle? It will help you to puncture through your skin, puncture through your vein so that the catheter can go inside and situate itself into the vein. So once it has entered the vein, what you do is you remove it and the needle is removed. Okay, this way your needle will be removed and what remains inside is your cannula. Now, can you see this is completely flexible? So what happens is when you've seen a cannula being inserted, what happens the moment that needle is removed, we press this cannula along with your skin. We press this cannula so that the vein is occluded and no blood comes outside. Now this part is open. So what you do? Your lure lock comes back in your action. What you do? You secure this cannula with this. You secure this cannula with this lure lock. Okay. So these are the parts of the cannula that you need to know. In the next class, we are going to discuss about the color coding of the cannula and which cannula is used for what purposes. Thank you.